As you can tell from my residual accent, I grew up in New York. I went to college at Yale and then did my MD PhD program at the University of Chicago in pharmacology and physiology. After I came to Stanford as an intern and resident in internal medicine, and during that time got very enthusiastic about critical care, went on to do a critical care fellowship, and then joined the faculty in the Department of Medicine doing critical care, emergency medicine, and clinical pharmacology. I spent several years as a faculty member, developed a laboratory doing translational animal research. But during that time, I worked with the anesthesiologists in critical care medicine at Stanford and came to recognize that they had skills taking care of complex, critically ill patients that I did not have, and decided to do anesthesia residency training. I did that at Stanford and then joined the faculty, this time as a part of the Department of Anesthesiology, now the Department of Anesthesiology, Perioperative, and Pain Medicine. My career for the next 15 years was very rewarding to me, dividing my time between clinical care, both in cardiac anesthesia and in the ICU, education, and importantly, again, continuing to spend about half of my time running a laboratory where we focused on understanding mechanisms of pulmonary hypertension and developing treatments on the basis of those mechanisms. During that time, I never thought about a major administrative role such as chair of the department, and assumed that I would continue on this path of clinical care, education, and research throughout my career. However, near the end of the 1990s, we had a search for a new department chair. And when I interviewed the people who were coming from outside Stanford, I was concerned that they did not really appreciate the culture which we had developed at Stanford, and one which I thought would be important for the continuing success of the department. I therefore became a candidate in the search and was eventually appointed chair of the department in 1999. It, for me, has been a very rewarding change of career. I very much have enjoyed being chair of the department. As chair, really focus on three things. One is career development of our faculty, building their careers. The second is a role in building programs. And the third part is dealing with people and their problems and helping, hopefully, to provide advice for the problems which develop. I continued to do my clinical care teaching, research, and now spend about half of my time as chair of the department, and the department has increasingly grown so that we're now up to about 200 faculty members. Personally, I've always had strong interests in two areas. One has been mathematics, and the other has been psychology, and I try to stay current on advances in those areas, and I think that has really helped me in my role as chair of the department, the mathematics being analytical about issues, problems, their solutions, and to a certain extent the complex finances of an academic medical center. The other part is psychology, helping to sort of understand people and help to give them insight into how they can best succeed in a place such as Stanford.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.